You've probably seen it, right?
Mm-hmm.
You look at lab results, maybe for work, maybe your own, and there are two guys, identical low testosterone numbers. I mean, really low.
Mm-hmm.
Yet one seems, basically okay, while the other feels completely wiped out. It's like hitting a brick wall with standard endocrinology.
It really is the classic clinical puzzle. Or think about this scenario. You take those same two men, same low T, put them on the exact same starting dose of TRT, testosterone replacement therapy.
Okay.
One guy feels fantastic in just a few weeks, a total turnaround. The other feels absolutely nothing, even months later, doing everything right.
That's incredibly frustrating. And yeah, the standard approach just looks at the supply, right? The T level in the blood.
Exactly. But what we're digging into today, based on some really solid research, is that the answer often isn't in the blood level. It's actually in the body's receiving equipment.
The hardware. You mean the genetic programming for the receptors? The body's antennas for testosterone.
Precisely. We need to shift focus from just the hormone amount to how efficiently the body actually uses that hormone. And the key, the real unlock here, is something called the CAG repeat polymorphism. It's in the androgen receptor gene.
CAG repeat polymorphism. Okay, so not the signal strength, but the quality of the antenna receiving it.
Right.
For listeners maybe not deep into genetics, what exactly is a CAG repeat?
Right. So CAG stands for cytosine, adenine, guanine. It's a 3-letter DNA sequence, a trinucleotide. And in this specific gene, the androgen receptor gene, this CAG sequence is repeated over and over again.
Like CAG, CAG, CAG.
Exactly. And critically, this sequence tells the cell to add the amino acid glutamine. So think of it like building a chain with glutamine links. The number of CAG repeats dictates the number of glutamine links in a specific part of the receptor protein.
And that chain length.
Yeah.
That determines how well the receptor works.
Yes, and this is the absolute core takeaway. It's an inverse relationship. Remember this. Shorter CAG repeats mean a stronger receptor function. Higher sensitivity to androgens like testosterone and DHT, the receptor is just better at grabbing and using the hormone.
Okay, shorter means stronger, more sensitive. So then, longer CAG repeats, that means the receptor is weaker, less sensitive overall to the testosterone floating around.
You got it. It's like having it may be a fancy radio, but the antenna connection is a bit loose. The signal's there, but it's not coming through clearly.
That makes sense. So the goal for us today is really to unpack how this single genetic variation, just the length of this repeat section, acts like a kind of volume dial.
A volume dial. Yeah, that's a great way to put it. Influencing almost everything. Personality, mood, fertility, even cancer risk, and crucially for many listening, how well TRT is actually going to work for you.
Let's dive into the structure a bit because the why behind this is fascinating. Where exactly in the receptor gene are these repeats? And why does that glutamine chain length matter so much at the molecular level?
Okay, so the AR gene itself is located on the X chromosome, and these CAG repeats, they're found right in the first part of the gene, what geneticists call exon 1.
Exon 1, why is that spot important?
Because that part of the resulting protein is really involved in how the receptor interacts with other molecules, specifically co-activator proteins. These are like helper molecules that are needed to actually transmit the testosterone signal inside the cell nucleus and turn genes on or off.
Ah, okay. So testosterone is the key fitting into the lock, the receptor, but the co-activator is like the hand that actually turns the key to open the door.
That's a perfect analogy. Now, the molecular logic, simplifying a bit, fewer CAG repeats mean a shorter glutamine chain. This shorter chain makes that part of the receptor protein more structurally stable. Less floppy, you could say.
Less wobble.
Less wobble, exactly. And that stability means the hormone binds more tightly, and those co-activators can latch on and do their job much more effectively. The result is increased transcriptional activity, basically. The receptor is better at turning genes on.
Got it. So conversely, the longer that glutamine chain gets, the more unstable or maybe floppy that region of the receptor becomes, which weakens the connection, both for the hormone and for those crucial co-activators. The signal gets through, but it's maybe weak, a bit garbled.
It's like a structural bottleneck. And to make this concrete, let's look at the numbers. What's the typical range of these repeats in people? For European men, the sources generally cite a range from 9 repeats all the way up to 37.
9 to 37. Wow, that's a huge variation in length.
It is, and the population averages are also really telling. They suggest some pretty fundamental genetic differences in baseline androgen sensitivity across groups.
What did the data show for averages?
Well, the average for Europeans is around 21 repeats. For individuals of African descent, it's lower, around 17. And for Asians, it tends to be higher, averaging about 23.
Okay, wait. So if shorter means more sensitive, then on average, based purely on genetics, someone of African descent might have a more sensitive androgen system than someone of Asian descent.
That's what the population genetics data suggests, yes. And think about the clinical implications. Higher sensitivity, those shorter repeats, might mean some tissues, like the prostate maybe, are more responsive even to normal T levels.
Potentially increasing risk for things like BPH.
Potentially. Whereas lower sensitivity, the longer repeats, could mean someone starts feeling deficiency symptoms even when their blood test looks, quote unquote normal. Their personal baseline for feeling good is just genetically set differently.
Which brings us right back to that paradox we started with. Because the research is pretty clear, isn't it? Being technically normal on a lab report doesn't mean much if your receptors aren't really listening effectively.
That's absolutely right. The studies show men with a higher number of CAG repeats have an increased risk of developing those classic hypogonadism symptoms: fatigue, low libido, brain fog, mood issues, even if their serum T is comfortably within the normal range, say over 340 ngDL.
It completely flips the script.
Yeah.
You could be, like, structurally hypogonadal even if you're not chemically hypogonadal.
Well put.
But the psychological side still blows my mind. This isn't just muscle and sex drive. It's mood, anxiety, brain function.
The links to mental health are really striking. Regression analyses consistently find this positive correlation. The more CAG repeats someone has, meaning lower sensitivity, the higher the reported severity of anxiety, clinical depression, panic attacks, even phobias.
And that holds true regardless of their actual testosterone level.
Yes, independent of their endogenous T levels.
Yeah.
So having genetically weaker T receptors seems linked to a greater tendency towards anxiety and mood issues. That's a massive insight that just looking at T levels completely misses.
It's huge. And does it work the other way? Are there benefits to having short repeats, high sensitivity?
Surprisingly, yes. Some studies found an association between short CAG repeats and, get this, intellectual giftedness IQ over 130 in young boys, even before puberty when their T levels are naturally very low.
Wow.
It suggests that maybe a genetic predisposition for high androgen responsiveness could actually support certain aspects of cognitive development.
That's incredible. This tiny genetic sequence seems to be shaping behavior intelligence. Did the research touch on relationship aspects too?
It did, so it gets complex. For instance, some studies noted longer repeats in contexts like transsexualism, but the causality there is debated. More straightforwardly, in men with Klinefelter syndrome, who often face unique challenges.
Right, XY.
Yes. In that group, having shorter CAG repeats, that higher sensitivity, was linked with better outcomes, like forming stable relationships and achieving higher education or professional roles. It seems fundamental to socio-behavioral outcomes.
Okay, let's shift gears to physical health risks. How does this CAG volume dial affect things like fertility or prostate health?
For fertility, it's quite clear-cut. There's a negative relationship. The more CAG repeats you have, lower sensitivity, the less effective spermatogenesis seems to be.
So lower sperm production.
It can lead to oligozoospermia, which is a low sperm count, likely because the testicular cells aren't responding optimally to the androgen signals they need.
And in extreme cases, this leads to specific syndromes.
Exactly. The most well-known is Kennedy's disease, or spinal and bulbar muscular atrophy. It's primarily a neurological disorder, but it's caused by a very large expansion of these CAG repeats, usually 36 or more.
36 plus.
Yeah, and that results in severe androgen insensitivity, which manifests not just neurologically, but also causes hypogonadism and infertility.
Okay. And what about the prostate? Common issues like BPH, benign prostatic hyperplasia. How does AR sensitivity play in?
This is where it gets really practical for a lot of men. The data shows AR gene polymorphism significantly impacts the risk of BPH becoming severe enough to need surgery.
How significantly?
One study found that having repeats outside the sort of middle range, specifically less than 20 or more than 24 repeats, compared to healthy controls, increased the odds ratio for needing surgical intervention by 1.92.
Wait, stop. Almost double the risk of needing surgery for BPH just based on having slightly shorter or slightly longer repeats than average. That's huge.
It's a major factor. And drilling down further, those shorter repeats, the high sensitivity ones, correlate specifically with moderate to severe obstructive urinary symptoms.
So if your body is highly sensitive to testosterone and DHT, the growth signals hitting the prostate are amplified, leading to worse BPH symptoms faster.
That appears to be the mechanism, yes. More aggressive growth signaling.
What about broader metabolic health? Cardiovascular risk. Is high sensitivity protective or harmful there?
Generally, it seems protective metabolically. Men with shorter repeats, high sensitivity, often have lower body fat percentages, better insulin sensitivity, which are all good things.
But is there a downside?
Sometimes. The data occasionally links these short repeats with lower levels of HDL cholesterol, the so-called good cholesterol. So it's not universally positive, but mostly beneficial metabolically.
And the flip side, having the longer repeats, the weaker receptors.
That's where cardiovascular risk seems to increase, especially if you have other conditions. For example, in men with type 2 diabetes, having a higher number of CAG repeats has been shown to impair endothelial function.
The lining of the blood vessels.
Exactly, both how they relax and what they secrete. This dysfunction significantly bumps up the risk for cardiovascular problems like atherosclerosis.
Okay, so high sensitivity seems generally good for metabolism, maybe a slight HDL dip. Low sensitivity, though, seems to worsen cardiovascular risk, especially with diabetes. This CAG count is clearly dictating a lot. Let's make this really actionable now. How does knowing this revolutionize TRT?
Well, it argues strongly that genetic testing for CAG repeats should be maybe not standard yet, but certainly considered essential for predicting how well someone will respond to TRT.
Probably because you can't guess their sensitivity just from a blood test.
You absolutely cannot. Knowing their CAG repeat length beforehand gives you a powerful predictive tool, way beyond just looking at serum T levels.
Okay, let's take the high sensitivity guys for short repeats. If a doctor knows this about a patient starting TRT, what should they expect?
Expect a strong response, often quite dramatic. These men tend to see significant metabolic benefits improvements in fasting insulin, triglycerides, blood pressure, and, importantly, much better recovery of sexual function.
Measured by things like the IIF-15 score.
Yes, the International Index of Erectile Function. They generally show much greater improvement on those scores because their receptors are just soaking up that administered testosterone and using it effectively.
Makes sense. But you mentioned potential downsides earlier,
Yeah.
the amplified growth signals.
Exactly. That's the critical caveat for the high sensitivity group. Because they are so sensitive, having very short repeats, the studies often use a cutoff like 20 or fewer, does increase the risk of side effects on TRT.
Like what specifically?
Things like a measurable increase in prostate size or pancreatic size, and a faster rate of rise in PSA, the prostate-specific antigen.
So for these men, the key is
Start low, go slow. Lower doses of testosterone might be sufficient to get the desired therapeutic effect, while hopefully minimizing those growth-related risks. Dose adjustment is key.
right. Now what about the other end of the spectrum? The man with long repeats, the genetically lower sensitivity? How does knowing his CAG count change his treatment plan?
For him, the expectation is a diminished response, especially at standard starting doses. So if that man starts TRT and isn't feeling much improvement,
The doctor knows why.
the doctor knows it's likely his inherent genetic resistance, not that he's not taking the medication or something else is wrong. And that knowledge gives a clear rationale. This man likely needs a higher dose.
You need to push past that receptor resistance.
You need to increase the dose, sometimes significantly, to really saturate the system and get enough signal through those less efficient receptors to make a difference.
This information sounds absolutely indispensable for anyone prescribing or taking TRT. Is this test actually available? Can the average person get it?
Yes, the sources confirm it is available. Genetic tests to measure the CAG repeat length in the AR gene can be ordered through specialized genetic testing labs. Prevention genetics is one example mentioned.
And it requires a doctor's order, using standard lab tech.
Generally requires a healthcare provider's order, yes. And they use standard reliable methods like PCR polymerase chain reaction, followed by sequencing to count the repeats accurately.
Okay, the big question then, what's the cost? And if it's so useful, why isn't it routine before starting TRT?
The cost mentioned in the source material is around $990.
Wow. Okay, nearly $1,000. That explains a lot.
It does. That price point is a major barrier. So while the test is available, it's not typically covered by insurance for this purpose, and clinical guidelines haven't yet caught up to recommend it routinely.
So we're stuck in this situation where there's a scientifically valuable test that could prevent months of trial and error dosing and frustration. But cost and lack of formal guidelines mean doctors and patients are often still guessing, based only on blood levels and symptoms.
That's largely the reality today. The research strongly suggests this genetic information is crucial for really understanding male health across the board, but the clinical and financial infrastructure isn't quite there yet. The hope is that in the near future, this kind of personalized genetic insight will become central to managing androgen deficiency effectively.
It really feels like the ARKeg repeat count is that missing link, doesn't it? It bridges that huge, frustrating gap between the hormone number on the page and how you actually feel and function.
Absolutely. It helps explain why just measuring serum T often falls short.
So wrapping up our deep dive today, it's clear this isn't just about fine-tuning TRT doses, as important as that is.
No, it's much bigger. It's about recognizing a fundamental piece of genetic code that shapes so much of male physiology, psychology, disease risk like BPH, maybe cardiovascular issues, and metabolic health throughout life. This hidden genetic volume dial is incredibly powerful.
Which leads perfectly into our final thought for you, the listener, to chew on.
Yeah, think about this. If just this one small genetic variation, simply the number of times 3 DNA letters are repeated in one gene, can so profoundly change how effective a major hormone like testosterone is.
Right.
What other silent genetic instructions, similar volume dials, are operating under the hood right now, dictating our individual health journeys, our risks, our responses to treatments? And maybe more importantly, how close are we really to personalized genetic analysis becoming the everyday standard, not the expensive exception, in medicine?